Assalamu alaikum. Good morning, everyone. I am Dr. Sabrina Islam from Japan Bangladesh Friendship Hospital at Breast Care Unit by Dr. S.K. Farid Ahmed. Today, my topic is on inflammatory breast cancer, a rising concern as seen in a single unit representing the population of Bangladesh, a developing Southeast Asian community. What is inflammatory breast cancer? Inflammatory breast cancer is an aggressive variant of breast cancer characterized by rapid progression, higher metastatic potential, and early recurrence. The study aimed to look at the trend of inflammatory breast cancer among Bangladeshi population in perspective of Southeast Asian community. It showed that IBC is prevalent now among younger age group. The aggressive nature and increased incidence among younger females warrants for appropriate screening, recognition of the clinical signs early, and proper histopathological investigations. The objectives are to slow the growth of the cancer and to improve long-term survival, to develop standardized guidelines for diagnosis and management, to look at the trend of inflammatory breast cancer among Bangladeshi population in perspective of developing Southeast Asian community. The symptoms we usually found in inflammatory breast cancer are nipple inversion, swelling or enlargement of the breast, swollen lymph nodes, unusual warmth of the affected breast, breast pain. There might be increase of breast size. We found pitted skin like orange peel appearance, which we called pod orange change, thickened skin or breast tissue, a lump in the breast which might be or may not be palpable, breast redness, itching, changes in the breast shape, there might be nipple discharge or not, red bumps that resemble bug bites. There are few signs we found in IBC, which are swelling and redness that affect third or more of the breast. Skin of the breast may appear pink, reddish purple or bruised. Skin may have ridges, appear pitted like the skin of an orange, called pod orange change. May present with or without any palpable lump. Rapid increase in breast size, there might be sensation of heaviness, burning, tenderness in the breast, flattened or discolored nipple. Swollen lymph nodes may present under the arm near the collarbone or both. Here we can see some of the inflammatory breast cancer pictures which has been taken from our breast care unit. There are areas of discoloration, a bruise or rash spread over 1/3 of the breast. There we can see there is a dimpling and also there is flattened and inversion nipple. Methodology are on retrospective study was done on the patients in our breast unit for 5 years, which is from June 2019 to October 2024. Patients underwent systemic clinical examination showing rapid onset of breast erythema, which occupies at least 1/3 of the breast, nipple retraction, pod orange edema, and or warm breast with or without any underlying palpable mass. The investigation we usually do at first mammography followed by ultrasound, PET CT scan or CT chest and abdomen, pelvis and whole body bone scan. Tissue diagnosis is done by core biopsy with or without punch biopsy, followed by histopathology and immunohistochemistry. Materials we have taken from patient board website, which has the documentation of patient's history, examination findings, investigations and treatment. Treatment will do at first neoadjuvant chemotherapy, usually the first treatment to shrink the tumor. Surgery will do mastectomy with axillary clearance. Typically follows chemotherapy to remove the cancer. Radiation therapy, it often follows surgery. There are some targeted therapy which is given along with the chemotherapy if the cancer is HER2 positive. Result is from June 2019 to October 2024, total of 16 and 51 breast cancer patients, out of which we found 134 inflammatory breast cancer. The youngest was 22 years and the eldest was 87 years, with a mean age of 45 years. Of the 134, 67 patients, which is almost half of the patients, were below the age of 45 years. 8 patients with inflammatory breast cancer had distant metastasis, confirmed with tissue diagnosis, all of whom were below the age of 45 years. Conclusion. Inflammatory breast cancer usually represents about 1 to 5% of all the cases of breast cancer in the USA. 5% cases in the UK, where in Bangladesh, the percentage is relatively high, about 8.12%. Half of these patients were below the age of 45 years. So we can say now greater awareness, mammographic screening, leading to early diagnosis, and multidisciplinary management is the highly recommended to combat the increasing trend of inflammatory breast cancer in such populations. So fight cancer will say, no, be aware, take action, and fight breast cancer. Our motto of Pink October 2024 was no one should face breast cancer alone. Early detection saves lives, saves breast. Thank you.